Hello, my name is Shannon Studden, and I would like to welcome you to the Surviving and Thriving as a New Leader series. This program was developed in coordination with the Federal Office of Rural Health Policy by the Technical Assistance and Services Center, a program of the National Rural Health Resource Center, or the Center for short. The Center is a national nonprofit organization dedicated to improving and sustaining the health of rural communities. The Center provides technical assistance, information, tools and resources, and strives to build state and local capacity. The Center works exclusively with rural communities. It's been around for nearly 30 years and has worked with over 250 rural communities across 46 states, specializing in the transition to value and population health, collaboration and partnership, performance improvement, health information technology, and workforce. I've spent my career in the field of leadership development, and I know the positive impact that good leaders have on an organization and on the people who work there. I also know how hard it is to make the transition to a leadership role. And if you've gone from being part of a team to leading that same team, it can be even harder. Leadership isn't easy. It's why not everyone does it. But when you're brave enough to take on the challenge, you have the opportunity to make a major difference. In your role as a leader, the decisions you make and the actions you take not only influence patient care and make the workplace an enjoyable place to be, but also impact the long-term success of your organization and the health of your community. This series has been developed to support new leaders, make the learning curve just a little bit less steep, and share some tips, tools, and strategies to help you navigate the transition to leadership. The program is made up of 6 video modules, each lasting about 30 minutes. This first module is a few minutes longer since we're including some time to give you an overview of the program. The modules include both educational content and interviews with hospital leaders and experts from multiple locations across the United States. Each video module is accompanied by reflection questions and suggested activities that you may choose to use to learn more about how the topics from this series apply to your organization. We encourage you to go through this series with others in your organization, and if you do this, you might find value in going through these assignments as a group. If you're the only one from your organization, however, you'll still get just as much value from reflecting on these questions and engaging in the recommended activities between modules. The format of this program was designed with busy schedules in mind. While you should of course feel free to complete this series in any time frame that works for you, one suggestion is to watch a video module once per week or once every other week and spend time in between going through reflection and discussion questions and engaging in the suggested activities. Following this plan, you should be able to complete the series within about 6 to 12 weeks. Topics for the 6 modules are shown here on the screen. Before we get started, I want to say just one more thing about the program. All of the information presented here is based on sound empirical research done by nationally recognized experts. But because we want to make this a conversation, we won't make extensive references to the literature or published research throughout the video. We will, however, list references on the resource page on our website so that you can dig a bit deeper into anything you're interested in learning more about. We at the Center are also always available to provide additional supporting information or connect you to a resource or tool based on your need, and our contact information is provided at the end of each module and on our website. I'll end this overview by introducing you to the interviewees you'll hear from throughout the program. These people were asked to contribute not only because of their experience and knowledge, but also because they're viewed as role models in their communities and fields of expertise. We sincerely thank all of our interviewees for their support of this program and for their willingness to share their stories with us. So with that, let's get started on our first module. In this module, we'll explore what it means to be a leader. We'll take a look at some of the common challenges experienced by those taking on their first leadership role and share a few strategies for looking out for your own well-being as well as that of your team. So let's dive in. Let's start by talking about what we mean by a leader. In this series, we define a leader as someone who influences what other people do. There are several different ways that leaders show up in an organization. A leader might be someone who formally leads a team and has an officially recognized title, such as supervisor, manager, director, or officer. In this series, you might hear these referred to as formal leadership roles. A leader might also be someone who doesn't have a formal title, but periodically serves as a formal leader in ways like managing projects or filling in for a supervisor from time to time. Every organization is also filled with informal leaders. Informal leaders are those who are influential not because of a formal title, but because of their experience and strong relationships with others. While we spend time in this series exploring the responsibilities of formal leaders, like setting expectations, giving feedback, and hiring employees, we want to point out that many of the topics covered here are relevant to informal leaders. Whether formal or informal, we're all better leaders when we understand the long-term goals of our organization, build trusting relationships, and work collaboratively with others. Looking at the structure of an organization, we can think of formal leadership roles as organized into 3 different levels. Senior leaders are those responsible for the organization as a whole. They're charged with carrying out strategic goals and long-term planning for the organization. They might have titles like Chief Executive Officer, Chief Financial Officer, Chief Nursing Officer, or Executive Vice President. Mid-level leaders generally report to senior leaders. They may lead clinical or non-clinical areas and are often department leaders with manager or director in their title. They're usually responsible for meeting operational goals for their department. Frontline leaders usually report to mid-level leaders and often have words like supervisor or team leader in their title. They manage the day-to-day activities of a team and directly supervise frontline staff. And by frontline staff or frontline employees, we mean those employees who do not have a formal leadership role and carry out the day-to-day work of their department. Frontline staff are sometimes referred to as individual contributors. As a general rule, senior leaders are responsible for thinking long-term and focusing on the organization overall. Frontline leaders tend to be responsible for meeting shorter-term goals and focus on a narrower part of the organization, while mid-level leaders fall somewhere in between. Throughout this series, you may hear us refer to senior leaders, mid-level leaders, and frontline leaders. But we want to acknowledge that in many rural hospitals and clinics, there isn't a clear distinction between these levels of leadership. Many frontline and mid-level leaders wear multiple hats as working managers, meaning that they serve as both leaders and frontline staff in their area of expertise. Senior leaders often wear multiple hats as well, playing the role of strategic thinkers for the organization, while at the same time directly supervising the daily activities of frontline employees and sometimes even filling in for frontline employees when needed. So when you hear the terms senior, mid-level, and frontline leader, keep in mind that we're talking in generalities. We encourage you to think about what leadership roles are represented in your organization and how many hats each role wears when it comes to time frame and scope. If you asked 100 people what the role of a leader is, it's likely you'd get 100 different answers. Maybe one of the simplest ways to describe a leader's role is to inspire and guide others to achieve a common goal. Sounds simple, right? Of course it isn't. There's so much that goes into being a good leader.
Leaders are more than just, I consider, to be just leaders. You don't always have to be out front to lead. I expect leaders to be team members, to learn the staff, to be able to see the big picture, to understand where we are and where we need to go. I know people say, well, stay on the beaten path, but sometimes you can't. And leaders have to be able to think outside of the box and realize when something outside of the box works a little bit better than what is already written in stone. So, I just kind of look for them to be the big thinkers in the organization.
Our leaders have big responsibilities. Just in leading an organization, you're responsible for providing the mission statement and assessing whether you're meeting the mission. And then when you add diversity, equity, and inclusion, I think you have to recognize that there might be many people in your organization, including yourself as a leader, that don't fully understand the breadth of health equity, diversity, and inclusion. So as a leader, you have the responsibility of educating yourself, first acknowledging that there is an issue with equity in healthcare, then learn more about that issue and what that means, what that it may be based in systemic racism. Do you understand what systemic racism means? And then once you kind of educate yourself, then you have this awesome responsibility of making sure that you educate others in your organization. And it's a sensitive subject. So that means that in educating yourself and educating others, that these might be uncomfortable conversations for folks in the organization to have. But as a leader, you have to feel comfortable with the subject matter. And the only way to do that as a leader is to learn and understand and embrace the subject matter yourself.
Clinic leaders, their most important role is to make sure that we have the supplies that we need to do the day-to-day operations, to make sure that we have the staff we need to do the day-to-day operations, and honestly, to make some of those all the time responsibilities not interfere with our ability to provide patient care. We have a lot of collaborative effort on a daily basis, but I also think that when you sit down and you're working with people in a leadership role, looking at them and saying, being able to communicate with them and tell them what you need on the fly and what you need going forward is helpful. And for them to be able to come to you and tell you what they need so that way you're working together consistently.
As you heard in these clips, leaders carry a lot on their shoulders. If you're new to a leadership role, you're probably already well aware of this and have been working to make the adjustment to your new role for some time. Does it help if we tell you that this is a really hard adjustment to make? When we're individual contributors, we're responsible for getting our job done. It might be a hard job, but the boundaries around what we're responsible for and not responsible for are pretty clear, and we often have direct control over the work we do. When we're leaders, however, our responsibilities expand considerably, and to make it even more challenging, we have less control over the results. This is one of the major challenges experienced by new leaders, shifting our focus from getting work done ourselves to getting work done through others. Think about the role of a musician versus an orchestra conductor. A musician is responsible for the sounds coming out of their instrument, and to a great extent is the only person with direct control over the music they make. The orchestra conductor, on the other hand, is responsible for the performance of the orchestra as a whole, and can only work to influence the musician's behavior from the outside.
I think back now when I started in a management position, and I don't know how I survived. The things that I did then, I just think so differently now. As a nurse, you're always leading, because as a registered nurse, you have LPNs that work with you, you have nursing assistants that work with you, you have physicians that work with you, but because you're with the patient the entire shift, you're always that lead person that they look to. So I've been a leader ever since I've been in nursing. When I moved into management, I really did not understand there was a difference in management leadership thinking and staff leadership thinking. And as I grew in my leadership abilities, I've learned so very much. I think when I first started, I thought if I was asked a question, I was always expected to be the expert and to know what that answer was. And now I realize I don't always have to know the answer, and I don't always have to answer right now. Sometimes it's, well, let me check that, or let me think about that, so that you can give the best answer possible. And sometimes it takes you going to other people getting information. You know, you don't always have to lead the band to be the leader. I like being a team member and being included in that big team as overall. And if someone knows more about the subject, then by all means, I'm there. So that is where I've come from, where I've been, just being out there thinking I had to know everything, to saying it's okay. I'm a part of this team. I don't have to know it all, and I don't have to answer right now.
I think one of the biggest challenges for me transitioning to leadership at the clinic was not knowing my fellow employees well. I had actually seen most of them as a patient prior to becoming an administrator, but I think there were some preconceived notions about who I was and why I was coming in. And as we know, when you assume things, it's not always true. I think with those assumptions, there were some walls built up that some of them I just can't get over, or I haven't been able to get over. But communicating my role and what we were doing as a clinic was a huge part of that. And repetition, I think, is the biggest part. And that's kind of how I feel sometimes with communication, is I just keep saying things. Sometimes I try and reword it just a little bit to get everybody on board, but it's a lot of repetition to make sure that everybody understands the way that you want them to understand.
Things that you think don't matter, but they do. A facial expression, body language. That's why when I'm in an office right now, my door is never closed whenever I'm in here. It's closed right now, but it's never closed. And so people expect to be able to walk in and out, and they do. I know a lot of leaders say, well, I can't do that because I have stuff to do. But you would be surprised at what people think if that door stays closed. They think that you're standoffish. They think that you're not a part of the group, that you consider yourself as that person standing up, just pointing, saying, you do this, you do this, you do this, you do that. So just pay attention to the little things. Carry yourself like you'd want someone to carry themselves around you. And you'll be able to, regardless of whether it's a hospital, a business, or whatever. And leaders, we're all leaders. We lead in homes. We're the one that leads when we all go out shopping. When I'm with this group and we're eating supper, so-and-so usually is the one that starts off, and they're the leader. So you're always leading. It's being able to work through that leadership and understand what leadership, being a team member, a part of an overall group, and what the overall goal is, so that you can use those leadership skills that are needed in that particular situation. So leadership is leadership.
The skills and knowledge needed of successful healthcare leaders today are very clear, and they're quite different from the skills and knowledge needed a few decades ago. The critical competencies you see here are based in research and are an amalgam of two sets of healthcare leadership competencies, one from the Center for Creative Leadership and one from the National Center for Healthcare Leadership. Links to publications from both of these organizations can be found in the resource guide accompanying this series. So here's what we know about the critical skills and knowledge that can help new leaders settle into their roles and have a positive impact on their team, their colleagues, and their organization. They're collaborative leaders. They communicate openly, inspire trust, and coach and develop others. They create an environment that values diversity, equity, and inclusion. They understand the big picture of the organization overall and how their team or department contributes to the hospital or clinic's long-term success. They understand the changing healthcare environment and how they play a part in it. They set clear expectations for their team, give positive and constructive feedback, and recognize team members' efforts. They listen, communicate in ways that are meaningful to the other person, and constructively address conflict. They champion new ways of doing things and support others through the change process. They understand their own style and preferences and the impact they have on others. They manage themselves by adapting their approach to fit the situation and the people involved. And lastly, they look out not only for their teams, but also for themselves. They find healthy ways to manage stress, take time to connect with those who are important to them, and make space to relax and recharge. Looking at this list, it's really important to point out that it applies to both clinical and non-clinical leaders. In fact, in its collaborative healthcare leadership model, the Center for Creative Leadership emphasizes the importance of healthcare leadership being made up of both patient-focused business professionals and business-minded clinicians. The remaining modules in this program, along with the accompanying discussion questions and activities, are dedicated entirely to these topics. We'll use both clinical and non-clinical examples throughout these modules, and we encourage you to pay attention to all of them, whether you have a clinical or non-clinical background. Our intention is to build in opportunities for clinically focused leaders to expand their business knowledge, and for business-minded leaders to expand their understanding of the patient care side. In the next module in this series, we'll help you build your organizational awareness, understanding how changes in the healthcare environment may be impacting your organization and how these changes may affect you and your department, strategies for building relationships across the organization, and looking at your organization through a diversity, equity, and inclusion lens. Between now and the next module, we encourage you to reflect on these questions on your own or discuss them with your colleagues to help you think through how the information covered in this module applies to you and your organization. Why did you choose to take on a leadership role? How do you see yourself having a positive impact on your team and your organization? What's the biggest challenge you've faced as you transitioned into a leadership role? How have you addressed it? If you're still struggling with this challenge, who might you lean on for support or guidance? And how have you learned to be a leader? What role models and mentors have helped shape your approach to leadership? And here are some things you might consider doing before you move on to the next module. We especially encourage you to complete the Leadership Styles Inventory to learn more about your preferred style. We'll come back to the concepts from this inventory throughout this series. Complete the Leadership Styles Inventory and hang on to your results. And if you're completing this series with colleagues, share your results with them. Complete the Leadership Competencies Self-Assessment to rate your knowledge and skills in each of the areas mentioned in this module. This tool will also help you identify the areas where you'd most like to strengthen your knowledge and skills, and how you might do that, aside from this series, of course. Talk to leaders you admire about their perspective on leadership. Some questions you might ask include, why have you chosen to be in a leadership role? What do you like about it? What's most challenging? What do you see as your unique contribution as a leader? What advice would you give to those new to leadership? Take a look at your organizational chart. What positions would you categorize as frontline leaders, mid-level leaders, senior leaders, or a blend of more than one of these? For additional information and resources on any of the topics covered in this module, see the resource guide that accompanies this program by searching for Leadership Fundamentals within the Center's resource library. And of course, please feel free to contact us at the Center anytime for additional support. We thank you for joining us today, and we look forward to continuing the conversation over the next few months.